Hi, my name is Jessica, and for this assignment, I'm going to talk about the podcast Pain Management Doctor was a one-man crime wave. I picked this podcast because the title sounded interesting, and I wanted to know what it was about. After listening to the podcast, I realized how much it connected to our class and how we've been learning about healthcare policies and the ethics of it. So, this podcast goes into the case of Dr. Charles Fred Gott, a doctor in Kentucky who went from being a cardiologist to running a pain management clinic. But instead of actually helping people with their pain, he ended up becoming one of the biggest opioid prescribers in his area. Naturally, investigators got involved and started to look into why so many of Dr. Gott's patients are prescribed opioids. Dr. Gott's patients came in with pain, and instead of evaluating them properly or referring them to physical therapy or getting them MRIs done or even creating real treatment plans for them, he just prescribed them opioids. This caused the patients to depend on the drugs, and this meant that they were coming back regularly, and this meant that he was getting consistent money, which is one of the reasons why people think that he was doing this and why they think he switched from being a cardiologist to a pain management physician. On top of prescribing opioids recklessly, he was also performing unnecessary procedures like EKGs and breathing tests every 3 months, even if the patients didn't need them. So he wasn't only committing fraud, but he was also committing unethical medical practices. Eventually, investigators got enough evidence and pieces that Dr. Gott ended up getting more than 8 years in prison. So how does this tie into things we talked about in class? First, doctors have legal duties when it comes to giving out controlled drugs. They can't just give out opioids without any real medical reason, and that's exactly what Dr. Gott did. He performed and billed for unnecessary tests, and that's considered fraud and goes against the law according to Medicare and Medicaid. Secondly, this case shows why there are agencies that overlook healthcare providers. If nobody was checking, he could have kept harming his patients for years. Policies around prescribing opioids and insurance billing are there to keep us, the patient, safe. Third, Dr. Gott went against basically every ethical principle. He harmed his patients, he didn't act in their best interest, and he took advantage of these vulnerable people. He broke the trust that a patient should have with their doctor. His unethical decisions contributed to addiction, suffering, and an already huge public issue like opioid crisis. Listening to this podcast made the opioid crisis feel more real. I hear about it in news or in lectures, we learn about it, but this really just shows how one provider's choices can impact an entire community and just how big this crisis is. It also helped me understand how important oversight of providers are. If these agencies hadn't stepped in, a lot more people could have been harmed and thrown into addiction. One of the biggest takeaways for me is how easy it can be for someone or a provider in the position of power to abuse it, and why ethics and responsibility matter so much in healthcare. But overall, this podcast was an eye-opener. It showed how things can go really wrong really fast, but also showed me how important it was that there are people and policies in place to stop this malpractice. Thank you for listening, and I hope you found it as interesting as I did.